Hi, I'm Dr. Michelle with Treble Health, and in this video, I'm going to be discussing the link between COVID-19 and tinnitus. Coronavirus is an infectious respiratory disease. It primarily affects the respiratory system, but there have been manifestations of the disease within our neurological systems, the central and peripheral nervous systems, as well as our skeletal muscle systems. There have also been reports of the disease affecting the auditory system. This results in symptoms of hearing loss, tinnitus, otalgia or ear pain, as well as dizziness and vertigo. Many individuals worldwide have reported changes to their hearing or the development of tinnitus following either the COVID-19 vaccines or the actual infection. Over 15,000 cases have been reported of tinnitus following the COVID-19 vaccine in the US's Vaccine Adverse Event Reporting System, also known as VAERS, which is a vaccine safety monitoring system. Only the Johnson & Johnson COVID-19 vaccine lists tinnitus as a possible side effect, although it has been reported in both Pfizer and Moderna COVID-19 vaccines. The relationship between COVID-19 and tinnitus has been under investigation since individuals have been reporting changes to their hearing, balance, and tinnitus following contracting COVID-19. It's important not to forget the relationship between stress and anxiety and tinnitus because oftentimes contracting COVID-19 also results in periods of stress and anxiety from not feeling well, as well as from the isolation that has to take place until you're no longer contagious. Various studies have found that the onset of tinnitus varies greatly from either contracting COVID-19 or receiving one of the COVID-19 vaccines. So for some, the symptoms tend to arise immediately, whereas for others, they can occur several weeks later, which makes it harder to know whether or not the symptom of tinnitus is arising because of changes or damage to either the peripheral or central auditory system or because of external factors like stress, isolation, financial concerns, and loss as a result of getting sick. The resolution of tinnitus also varies greatly, from days to months in many of these studies. Many individuals had been reporting auditory symptoms prior to any research corroborating their symptoms have been reported or released to the general public. It wasn't until the fall of 2021 when research out of MIT and Massachusetts Eye and Ear confirmed that SARS-CoV-2, the virus that is responsible for COVID-19, does in fact infect inner ear cells. This was discovered by using tissues of both mice and humans as well as in vitro cellular models. So after this research, it finally helped to corroborate many of the symptoms that individuals all over the world were starting to experience after either contracting the virus or receiving one of the COVID-19 vaccines. It is known that there are many viruses that can cause inner ear infections that result in auditory symptoms, and now we had proof through this research that SARS-CoV-2 also directly affects the auditory system in some individuals. The World Health Organization, or WHO, has said that there is a possible link between the COVID-19 vaccines and tinnitus, but it notes that there's need for more data and more monitoring before they can make an official statement on whether or not there's a true connection between the COVID-19 vaccines and tinnitus.
This is a short break from today's video to announce the Tinnitus Guide by Treble Health. Do you want to learn about the newest tinnitus treatments and management tips? Click the link in the description of this video to get your free copy of the Tinnitus Guide by Treble Health.
In one study, researchers surveyed 3,000 individuals with pre-existing tinnitus who had contracted COVID-19, and they surveyed individuals from 48 different countries. 40% of the individuals reported exacerbated tinnitus following contracting the COVID-19 virus. The reason for auditory symptoms following either the COVID-19 vaccines or contracting the COVID-19 virus has been linked to inflammation in either the brainstem, the auditory system, as well as hypoxia or lack of oxygen to parts of the auditory system. Many individuals have reported a new onset or a change to pre-existing tinnitus following one of the COVID-19 vaccines. One of the hypothesized reasons as to why this may be happening is because of an hyperactive or abnormal autoimmune response to the vaccine. Immunization anxiety-related reaction can't be ruled out as a contributing factor. Some individuals may be experiencing a change or increase to their tinnitus as a result of this immunization-related anxiety. One study published this past summer reviewed the prevalence of tinnitus following COVID-19. They interviewed 279 individuals, 201 of them did not report having tinnitus following COVID-19. 78 individuals did report having tinnitus following COVID-19. This study supported the link between tinnitus and COVID-19, but nonetheless, it's important to remember that the majority of the individuals did not report changes or new onset of tinnitus following COVID-19. But it is possible to have a new onset or an exacerbated tinnitus reaction after having COVID-19. Reviewing other recent research on the topic of tinnitus and COVID-19, it was found that the majority of individuals who do experience audiologic symptoms following COVID-19 do tend to resolve within a few weeks of having the virus. But nonetheless, there's a great portion of individuals who do experience symptoms following COVID-19, but may not actually express respiratory type symptoms. So if an individual has a sudden change to their hearing or a sudden onset of tinnitus, or their tinnitus, pre-existing tinnitus has been exacerbated, or they start to have issues of balance or dizziness, it would be worth having a COVID-19 test completed to see if that's a possible cause of these new symptoms or this change in pre-existing conditions. After reviewing several research studies that have looked at the connection between COVID-19 and tinnitus or other audiological symptoms, it has been found that typically audiologic symptoms of hearing loss, tinnitus, otalgia, oral fullness, or dizziness and imbalance tend to occur within 1 month of having COVID-19-like symptoms. But in the majority of individuals, these symptoms tend to resolve within a matter of 2 weeks or so. Many individuals in this study only experienced audiological manifestations of COVID-19 and didn't have any actual respiratory symptoms. So if you are experiencing a change to your hearing, a change to tinnitus, a change to your balance, or a change of oral fullness or pressure or pain in your ears, it may be worthwhile considering having a COVID-19 test completed to see if that might be the cause of your sudden changes to your auditory system. In a recent study published in September 2022, the researchers were looking at comparing new onset tinnitus following the COVID-19 vaccine as compared to 3 commonly given vaccines: the influenza vaccine, the Tdap vaccine, and polysaccharide pneumococcus vaccine. They were looking at individuals who reported tinnitus 21 days after having received one of these vaccines. The percentage of individuals who experienced a new onset of tinnitus following their flu vaccine amounted to only 0.062%. Following the Tdap vaccine, it was 0.068%, and following the polysaccharide pneumococcus vaccine, it was 0.088% of individuals who had a new onset of tinnitus within 21 days of having received the vaccine. So it seems that some of the most common vaccines that are given have a higher incidence of new onset of tinnitus than that of the COVID-19 vaccines. Some of the takeaways from the research that has already been conducted on the connection between COVID-19 and tinnitus include that for some individuals, having either the virus or the vaccines can result in audiologic changes to either their hearing, tinnitus, balance, even symptoms of fullness in their ears or ear pain can occur. The likelihood is quite low as compared to that of other commonly given vaccines, as well as other common viruses or infections that one may encounter throughout your lifetime. Nonetheless, the research does seem to support that there is a link between COVID-19, either the viral infection or the vaccines, as well as tinnitus and other audiological symptoms. We hope you enjoyed this overview on the relationship between COVID-19 and tinnitus. If you have any other questions, please don't hesitate to comment below. And if you haven't already subscribed to our channel, please hit the subscribe button to not miss any of our new content.
Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.